On this episode of the eClinicalWorks podcast, we talk outcomes and experience in healthcare. Which is more important, or are they connected more deeply than we realize? Welcome to this episode of the eClinicalWorks podcast. I'm Adam Salati, and joining me today is my co-host, Brian Hughes. Brian, how are you doing today?
I'm doing great today, Adam.
Brian, when I was getting ready for this episode, I came across an image that I think sums up this topic pretty nicely, and I wanted to know what you think of it. Are you ready?
All right, let's take a look.
All right, here we go. Here's the image.
Oh, okay. All right, I see a cruise ship, some ocean water, and a beach. To me, that looks like a relaxing spot.
Relaxing would describe the experience, right? Well, in healthcare, we're often focused on the outcomes for the patient. But on a cruise or in our personal lives, we're often focused on the experience. The experience is the outcome. And it got me wondering whether the two are more closely related than we realize, even in healthcare.
Yeah, that's a great question, Adam. And we'll be examining that very subject together, as well as learning what eClinicalWorks customers have discovered using healthcare technologies.
Yeah, and programs like chronic care management, transitional care management, and telehealth are a few areas where these technologies are making waves. Do you see what I did there, Brian?
I catch your drift.
All right, well, without too many more puns, let's dive into some of these outcomes, starting with the impact chronic care management has had at Adult Medicine of Lake County and MMR Healthcare.
So CCM, prior to the world we live in today, always was a very unique program. eClinical was able to support us as we grew it very rapidly. But then as COVID began to become a concern in our local area, the real benefits of CCM came out. We knew exactly who needed to be talked to. We already had an existing intimate relationship with them. So immediately on day one, my care coordinators knew where to start. From that point, we had an existing relationship with their other caregivers, the other specialists. So it gave us a 10,000-foot view of that patient's healthcare over the next 60, 90 days, being with the quarantine, what office visits were important, what doctor's offices were still open.
Healthcare is a team sport. What CCM did, it created a formal tool to create a concrete team in which each person had a role to be able to carry through in between visits what needed to be done to accomplish our goals. That has been great. Actually, we haven't had anyone in the CCM program be admitted.
CCM is just one tool which has been used to drive improved outcomes for eClinicalWorks practices. But let's take a look at the difference transitional care management, or TCM, has made at Dr. Randy Walker Family Practice and again at MMR Healthcare.
Jumped into the TCM module in 2000 and the end of 2017. We realized that we had a problem. We knew we were doing a lot of TCM work, but we weren't seeing that. Every time we ran reports to capture those charges, that money was not there. As far as clinic readmissions, we were at about 1.29%, which, we're a small practice. That's okay. It's not where we want to be, but it's okay. Once we jumped into that TCM module, I checked this morning in our Q4 data for 2019, we're at 0.95 for readmissions. And so we're very happy about that.
We have eliminated in my practice completely any readmission for CHF, because with TCM, you can see you can constantly see what are the 5 things that are causing your patients to go to the hospital. By having one place where the analytics can be looked at by everyone, you brainstorm and put programs together, and you can see the development of the process as it goes along.
We have seen some incredible outcomes from eClinicalWorks customers with increased visibility and improved organization. These outcomes have also brought patients who have been reporting incredible experiences from the programs that were mentioned. We have 2 eClinicalWorks customers, Health Texas and Hope Health, who in our next clip demonstrate how outcomes and experiences are being intertwined.
I've noticed since we started the program, these patients believe that it's a VIP service, which is true.
I had a situation a few weeks ago where I contacted the patient's sister. The patient had recently had a stroke. and the family was caring for her at home. And she said that she's just exhausted from all of the restrictions, with the COVID-19 and trying to help her sister recover from the stroke. And she was just thankful to have someone to reach out and to be assistance. But I think it was just very important for her, for the patient's sister, to have that connection with the practice, because this is a difficult time for them as a family. So it's building a relationship with those patients and family members.
Now, think about the patients who are receiving this exemplary service experience. Those patients are going to want to keep working with that practice. They're probably going to refer that practice to people that they know, and they're going to be more engaged and responsive in their actual care. And, I think the other great thing is that this even provided a benefit to the family members who were feeling isolated and overwhelmed at that time.
And we can't talk about experience without mentioning telehealth. So many practices made telehealth a central part of care delivery over the past year, and it's been an impact for practices of all kinds. Let's look at the difference it's made.
The postpartum patients are, in a very delicate position where they're trying to go through a major transition from becoming a new mother. They're under risk for postpartum depression. You can't just do that over the phone. You don't get a sense of the patient over the phone. But when you're looking at them and you're talking to them, you can get a sense and get a better idea. And these new mothers are having a lot of anxiety, right? They're anxious because they're pregnant. They're anxious because they're pregnant during the COVID-19. So they want to establish with an obstetrician. They want to be able to go ahead and get that establishment.
Brian, behavioral health is certainly an instance where the outcome and the experience are almost one and the same. I think that's almost kind of perfectly proves my point in the beginning there.
That's right, Adam. Telehealth is also used by many other specialties with great effect. Pediatric practices are using telehealth to offer convenient ADHD check-in services. Orthopedic practices are successfully completing post-surgical evaluations. And I would be remiss to mention telehealth is a great complement to the CCM program, which is also designated to be used with patients who are not in the office. So telehealth can help patients feel more comfortable and connected from home.
Yeah, and Brian, not only do the patients benefit with telehealth, but this can also be used to improve the experience of those who work in the practice. I mean, think about it. With telehealth, providers or staff who need flexibility, maybe for family or health or even personal reasons, can still care for patients without needing to be physically at work.
It's amazing seeing how experiences directly tie with outcomes when it comes to healthcare, as the testimonials showcased and demonstrated today.
Now, all the tools that we discussed here today, Brian, are available directly within eClinicalWorks, chronic care management, transitional care management, and telehealth. They're all integrated into this comprehensive EHR system. And practices can learn more about those through documents and videos on my.eclinicalworks.com. Of course, eCW University is always available, as we say, and practices that are looking to start a conversation can get in touch with their strategic account manager or even the sales department to talk about adding these.
That's right, Adam. And this has certainly been an interesting experience. And I hope our listeners have had a great experience listening to us, discuss these, important topics. And thank you, Adam, for joining the podcast today.
Absolutely, Brian. I'd never miss an opportunity to talk with you. Thanks to everybody who is watching. Check out our other episodes on iTunes, YouTube, and my.eclinicalworks.com. Make sure you hit that like button and subscribe for future podcasts as well. The eClinicalWorks podcast, I'm Adam Salati.
I'm Brian Hughes.
And we'll see you next time.